Good morning. You're listening to Caregiver Crossing, a podcast brought to you by Joy's House. We're so blessed and thrilled that you're here. Caregiver Crossing is a podcast created just for you, the caregiver. I'm Tina McIntosh.
And I'm Terry Stacy. Hello.
Hello. And we're here.
I'm so happy to see you.
It's so good to be back. It's so good to be back. And, different, but good. And a podcast, it's pretty exciting. So how often are we doing this podcast thing?
Well, I'll tell you, we have been talking about doing this podcast thing for a while now. And I'm so glad that we're finally at it together. Tina and I did this a couple years ago for about 10 years on WIBC. And we got to know each other very well. And I love being with her. Her energy is fantastic. And when she said, here at Joy's House, we're going to bring this back to life, I said, let me be a part of it. So, that is how it worked, isn't it? I begged for this job.
Stop it. I mean, I think we all did, to be honest.
Yeah,
and we're coming together every week. We have experts from across the country, and we're here for you as caregivers. We want to provide the comfort and resource and joy to all of you.
Yeah.
Why choose a Sleep Number smart bed?
Can I make my site softer?
Can I make my site firmer?
Can we sleep cooler?
Sleep Number does that. Cools up to 8 times faster and lets you choose your ideal comfort on either side. Your Sleep Number setting. It's the Sleep Number biggest sale of the year. All beds on sale, up to 50% off the limited edition smart bed. Limited time. All Sleep Number smart beds offer temperature solutions for your best sleep. Check it out at a Sleep Number store or sleepnumber.com today.
Basically those of us who have been, will be, or are caregivers, which is all of us. So today we're talking with Dr. Profeta, and I have to tell you, I can't think of anybody better to be on the phone with. Plus, he told me he couldn't say no to me, so that makes me very happy. He is a 27-year veteran ER physician. He's a national award-winning writer, public speaker, LinkedIn. I mean, this man knocks his LinkedIn articles out of the park, and he's the author of the critically acclaimed book, The Patient in Room 9 Says He's God. So, Terry, I'm going to let you start with Dr. Profeta, but let me just say, welcome, Dr. Profeta.
Thank you.
So happy
Thank you.
to
My pleasure.
Just such a great guest and really known now everywhere. Everybody knows Dr. Profeta. And I think we have to start with COVID-19, Dr. Profeta. And you've written a couple of blogs about COVID-19 and it was interesting to look back at years ago. You wrote this amazing article about the flu and that you were genuinely worried about a pandemic and being ready for it. But you reported last month that you're seeing seriously ill patients delaying medical care during this pandemic. And that's scary and alarming. So let's talk about that trend for a minute. Tell us what's happening.
Well, I mean, we're still seeing it. And what I think, if you start to talk to a lot of my colleagues around the country, they're all sort of reporting the same thing. People that have had significant delays in seeking medical care, developing progressive strokes beyond the point that we can fix them, heart attacks where maybe in the past they would have come in for chest pain. They're chalking it up to being indigestion or other things. And then they end up with permanent heart damage, congestive heart failure. People are going into renal failure, kidney failure because their blood pressure is going unchecked or they're not getting in their doctor's offices or getting refills. And then also metastatic cancer. I mean, all of us are diagnosing, it seems like much more metastatic cancer than we've ever diagnosed in the past, where people are coming in with symptoms that have been smoldering for months on end, and they just don't go to the doctor's office or have their elective procedures done. And then by the time they show up to us, they're metastasized to the brain or the bone or other organs and having catastrophic outcomes because of it. So it's obviously really concerning. We want people to start getting back into their doctor's office.
It makes me want to cry. Hearing you say that brings tears to my eyes, because I think, is it because we're also scared to go into a hospital setting? We're afraid we're going to get COVID, so we just don't seek care? What is it?
Yeah, it's all of that. It's at the beginning of COVID, a lot of these elective procedures were put on hold, everything from elective cardiac catheterizations to colonoscopies and tests like that. So we're months behind in being able to catch up with those people that needed to have elective procedures done. And then you have a lot of elderly people that are literally frozen with fear and just not going to their doctor's office, which is fortunately why you're seeing an explosion in telemedicine. But a lot of those people don't have that tech savvy know-how to be able to do that kind of stuff. So we have to continue to be creative. We have to reassure, especially some of our older patients that are out in the community, that it's safe to go to their doctor's office and go to the ERs. So.
And I say this in jest, but it's hard to do a colonoscopy on telehealth.
Yeah, it's pretty difficult.
There are some procedures that just make it a little hard. So
a little too much social distancing.
I mean, Dr. Profeta, I'm not a doctor, but I feel like I got that one nailed.
Yeah.
So.
I do want to continue just a little bit with COVID, because now flu season is approaching, seasonal flu. And there's a lot of talk that we're going to get back into that same mode that you're talking about, where now we've got the flu, now we've got COVID, and especially for the elderly that are right now getting their flu shots. We all should be getting our flu shots. But I do want to ask you, in just what do you see here when it comes to the seasonal flu and COVID? Are you worried?
Well, yeah, of course we're worried. I have sort of made a prediction, and I think I'm going to stick to it, that I think we're on track to see one of the mildest flu seasons in history, but not because I think the virus is weaker than it normally is, but because all the social distancing procedures that we're putting in place and the hygiene aspects, hand washing, all that stuff not only protects you from COVID, it decreases the transmission of influenza. So I think we're going to see a lower rate of influenza transmission, but we have got to get people vaccinated for flu. We have to. The thing that worries me is that with COVID-19, realize that we didn't have a whole lot of people coming into the emergency department with COVID-19 symptoms unless they were critically ill or really sick. So what I mean by that is that at any given time during influenza, we get a ton of people that come in with flu-related symptoms. But what I worry about is that the bar of concern for people is going to drop with influenza. And that, so if they're having simple viral kind of symptoms, mild flu cases, they're going to be running to the emergency department worried that they have COVID-19. Whereas COVID-19 really is not that serious to kids and young adults. I worry that we're going to have a rush of younger people pouring into the emergency department fearful that this is COVID-19, whereas in actuality, they could probably just stay home, whereas flu is actually worse for them. So there's going to be that trouble for us in trying to discern whether people have influenza or COVID-19. The flu test is really rapid. The COVID-19 test isn't as quick. It can take, I think right now, 5 to 6 hours. And we can't park people in our ER for 5 to 6 hours waiting for a test result to come back. So that's what I'm fearful of more than anything, is that we're going to have a rush of these patients coming in and overwhelming our department.
Yeah, and it makes me think about our family caregivers. They're so quick to care for the kids or their loved ones that are around them, but they're not doing things to care for themselves. So is there any advice you have for those of us caring for others during this time period?
Well, I mean, and this goes back to that article that I wrote about what scares me more than Ebola back in 2014, is that, one of the things that we have to come to grips with, and I need to write an article about this too, is that we actually were very fortunate with COVID-19 from the standpoint that it did not impact healthcare givers really that much. I mean, we just weren't seeing docs and nurses fall ill to COVID-19, but guess what? They all get sick during flu season. And, so we really dodged a bullet, so to speak, with it. During this period of time with flu, we will start losing nurses and doctors to influenza. It happens every year. And, if we're getting drowned in flu and COVID-19 simultaneously, and we're losing doctors and nurses not able to work, now we have a big problem. But realize that was a very fortunate aspect of COVID-19. So we are still not really prepared for what do we do when all of our healthcare providers start falling ill. We also don't really know what sort of concomitant infections. Like what does the patient look like if they have influenza and COVID-19 simultaneously, or does it increase the risk of one over the other? Does COVID-19 lower your immunity and maybe increase the chance of getting flu? I don't know. But the data coming out of Australia is sort of reassuring. They're from the southern hemispheres, their flu seasons aren't as bad right now, and it probably has to do more with social distancing. So
that's a terrifying thought about having both at the same time. And so I think for our medical, caregivers, boy, we do have a lot to learn coming up. And for our family caregivers, I think the bottom line I'm hearing you say is they need to seek medical attention, whether it's a test that you've been putting off for a while, or if you have to go to the ER, just don't put it off, right?
Well, yeah, especially now. I mean, before we get into flu season, if you haven't had your yearly checkup, either contact your physician or do a telehealth visit, but get some of these things addressed now, so you're not coming into the emergency department in the height of influenza season. So address some of those issues with your blood pressure, kidney issues, heart issues. Get those things addressed now while there's time.
All right, so I know we're short on time. Dr. Profeta, I'd like to ask if you'll come back and talk with us. I want to talk a little bit more with you in a separate podcast about the actual vaccinations and some thoughts that go through my head. Some of them are a little crazy, admittedly. So, all right, well, we're going to let you go for now. We're going to be back next week with a new podcast. Terry, any closing words from you?
No, I'm just excited that we're back doing a podcast. I think the information for our caregivers is so important. And thank you, Dr. Profeta.
Okay.
All right. Until then, everyone, thanks for listening to Caregiver Crossing. Until next time, take good care of each other.